Hello everyone, welcome to our YouTube presentation. We the third year students of University of Boroka taking Managing Behavior in School with Dr. Kravia and our tutor Mr. Yuasi. I am representing Congo third year students of the University of Boroka taking Bachelor in Science Education. My colleagues and I are going to do a video presentation based on the topic alcohol consumption in PNG. And they are Luke Finchen, Robin Sima, Monica Lombo, and Michael Kessel. Firstly, we will outline the presentation as follows: the definition and background information of alcohol consumption in PNG, describe some negative attitudes of alcohol consumption in PNG, strategies to change bad behaviors, approaches of a behavior development theory, and we will end up with conclusion. What is alcohol consumption? Alcohol consumption refers to the act of taking or drinking beverage that contain ethyl alcohols, which is a physioactive substance found in drinks like beer, wine, and spirit. When taking alcohol, for the first 30 seconds, alcohols enter the bloodstream. Some is immediately expelled through brains and sweat. For the next 12 hours, the alcohol remains detectable in urine.
I am Luke Vincent. Will talk about the negative attitudes or behaviors of alcohol consumption in Papua New Guinea. Here are some attitudes or behaviors that caused by alcoholic. There are road accident, traffic disorder, loss of income, domestic violence, rape as well as death, and many others. But in here, I will talk about three things only. Firstly, road accident. When a person drives under the influence of alcohol, the risk of a road accident increases dramatically. Alcohol impairs both the brain and the body, making unsafe driving. Secondly, public disorder. It's a medical condition characterized by an impaired ability to stop or control alcohol use despite adverse personal or health consequences. Finally, loss of income. When a person frequently consumes alcohol, especially working classes, they are more likely to miss out work, late at work, and steal from company, which lead to loss of job opportunity.
I am Robin Chimo will elaborate on strategies to change the bad attitudes of alcohol consumption in Papua New Guinea. Here are some strategies which identified can change the bad attitudes of alcohol consumption. First is keep track. Keep track of how much alcohol you drink or consume. Second is find alternatives. If drinking of alcohol will occupy a lot of your time, then find free time by developing new health activities or hobbies. Third is count and measure. Know the standard drinking size so you can count and measure the drinks accurately. Fourth is set goals. Decide how many days a week you want to drink and what much drink you'll have. Finally is know your no. You are likely to be offered a drink or alcohol at the time when you don't want. Have a polite convincing of no. These are some of the strategies which are much healthy for changing negative attitudes of alcohol consumption in Papua New Guinea.
I'm Monica Lombo. I'll be talking about the process of behavior development theory for alcohol consumption. Behavior development theory explains how consumption, including problematic use, is learned and shaped through interactions with environment and individual experiences. This theory emphasizes the role of learning, reinforcement, and expectations in influencing drinking behaviors and provide frameworks for understanding and interview in alcohol use disorders. There are many approaches of behavior development theory for alcohol consumption, but I'll only elaborate one theory, which is cognitive behavioral theories. Cognitive behavioral theories explain, posit, and alcohol dependency in a learned behavior occurred through observation, imitations, and experiencing the positive effect of alcohol. Individuals may learn to rely on alcohol to cope with stress, social problems, and other problematic challenges. As alcohol effects are rapid and less effective than alternative coping strategies. Therefore, cognitive behavioral therapy aims to identify and mold through the behavioral coping skills to managing triggers, curbing, and improving overall functioning.
I'm Micah Kessie. To sum up, we all know that in Papua New Guinea schools, towns, and communities as a whole, alcohol consumption become a daily habit with its related issues. There are a lot of human attitudes and behaviors shown towards others in our societies are unhealthy and also unsafe when a person is under the influence of alcohol. However, there are strategies with the approaches identified and was presented, we believe will at least lower the rate of consumption of alcohol and reduce the problems, which normally created when one is under the liquor. It will be more beneficial if our MPs and leaders of this nation plan a strategy and enforce it with its penalties. Then will help reduce this bad attitude of alcohol consumption in Papua New Guinea.